welcome to HSBC. As I said earlier, my name is Sam Cooper-Gray. I work here in the building. I'm honoured to be able to host you guys today. The big alarm I said was going to happen, they then told me was not happening, hence why you didn't hear it, but that's good. So firstly, welcome to the building. I hope you enjoy the event we've got for you this afternoon. We are also going to feed you at some point during the event as well, so hopefully you'll enjoy that as well, and we have some drinks at the end as well as a bit of a celebration. I have some really boring stuff to do first, linked to the fact that I was just telling about alarms. Now that the time has passed and we're going to test them, my instructions are exactly the opposite to the instructions I gave you before. So if an fire alarm does go off today, now we aren't doing any more tests. So you just follow the signs out for the emergency exits. There's one over there, there's one over there. We have toilets in the building, so just go out and go to the left. It's left, isn't it? I'm not sure I'm the person they should have put in charge of explaining this. And so please do just follow me, probably, if any of the alarms go off from now. So thank you for coming today. I hope you enjoy the session. And I want to introduce you to Vanessa, who is going to compare and facilitate for the day.
Before I begin, I'd just like to say a big thank you to Sam, because it's thanks to her that we're in a building today and her support for MS Together. So thank you, Sam. So I am your facilitator. My name's Vanessa Ballally, and I'm honoured to be a trustee for MS Together. So we're in for a bumper day of talks, panels, and some networking. We've already heard some fantastic entertainment from our singer. There's been some food, which is always a good start. Before we begin, it would be great if you could share some of the sound bites that you hear today on social media. So whether you want to take a picture a little bit on later, let's get the buzz going and raise awareness of the wonderful work that MS Together does. So we've got the hashtag that's on there, MST Launch. If you're not following MS Together on Instagram or any of the socials, why not? So you've got a minute to do that. I will be checking. So without further ado, I'm going to hand you over to the lady that founded MS Together. So I had the benefit of meeting Amy for the first time at the National Diversity Awards, where she picked up her award for her category. I knew of MS Together through another connection, which we'll come on to a little bit later, but I was always in awe of the work that she did. So to see MS Together become a charity, I can't say, I think everyone in the room, Amy, is exceptionally proud. So before she comes up, a round of applause, please, for Amy.
This is the agenda for today. I was meant to click that before. Okay, so hi everyone. Firstly, thank you all so much for being here. For those of you who don't know me, I'm Amy and I'm the founder of MS Together, like Vanessa just said. I decided it would be a good way to start with my story and to go right back to where the idea for MS Together came from. So I was diagnosed with MS whilst I was on my year abroad from university. I was aged 20, living in Paris, honestly having the best time of my life. I had been in Paris for 7 or 8 months when I started to experience symptoms. So my walking, balance and coordination were all affected, and I was terrified. I remember Googling my symptoms pretty early on, and the first thing that came up was MS, closely followed by a brain tumour. My symptoms lasted for about 5 days before I plucked up the courage to go and see a doctor, which I'm sure you can imagine was very scary being in a different country. I was sent for some blood tests, but was told it was probably nothing to worry about. And the test came back normal, but I still felt like something wasn't right. I asked the doctor directly if he thought it could be MS, and he responded by saying, "No, you're far too young for that. I'm sure it's probably just a trapped nerve or something." But I wasn't convinced, so I requested to be sent for an MRI scan. And the doctor agreed to, in his mind, give me peace of mind. In his words, give me peace of mind. I went for my scan not really knowing how to feel or what to expect. Afterwards, I decided to fly home to the UK with my results to see a neurologist. And sure enough, I was diagnosed with MS. I'd already kind of got my head around the fact it could be MS, but the actual diagnosis experience was pretty horrible. I was simply handed some scary looking leaflets and told a nurse would be in touch. I didn't know anyone who had MS, but all I wanted to do was speak to someone who knew what I was going through. When I got home, I frantically started to search social media for other young people living with MS because I wanted to see people that I could relate to, people like me, people going through similar things, but I couldn't find much at all. And that's when I decided I wanted to share my story as much as possible. Within a few weeks, I decided to sign up for a skydive for a national MS charity, and I announced my diagnosis publicly for all my friends, family, and acquaintances to see. Everyone was so supportive, but also so shocked and concerned. I realised people didn't really understand what MS was, and there was a lot of misconceptions around it. I received comments constantly like, "You look so well," "You're too young to have MS," "Does this mean you'll need to use a wheelchair?" And a few months later, I decided to start a blog. I named it But You Don't Look Ill, after all the comments I got. And I tried to share as much of my journey with MS as possible. I wrote about everything, my time at university, dating, travelling, work, and so much more. Over the next few months, I had a number of people reach out to me to say they'd been looking for something exactly like that they also wanted to see someone young like them living with MS. They thanked me and told me how much it had helped them. Over the next few weeks, I spoke to these people individually, and it was then when I realised that I wasn't alone in wanting to speak to other young people. I decided to ask the people who had reached out to me if they'd be interested in joining a group chat with a couple of other young people living with MS. They all said yes, and that is basically where MS Together started. So, MS Together started with a handful of people, as I said, and it's now grown to a community network of over 1,200, and it's growing every day. Our current services include an online support network. So this is a platform where young people can meet others like them and get the answers to any questions that they have. We host virtual events. So there's 3 different types. So we have social events. So that's things like games nights, a cuppa and chat where people just meet and just have a chat about anything. We have supportive events. So one of them is called Let's Connect, and that's hosted by Marissa, who is a qualified therapist, mental health practitioner and facilitator. And we also host informative events as well. So that's things like webinars with healthcare professionals or MS specialists. And one that we did recently was with the UK MS Register, and we did a Q&A with a consultant, and it was really well received. So we do these virtual events about 4 to 6 times every month, and we try and make sure there's something for everyone. We also organise in-person events. So these are meetups organised at different locations across the country. We've had lots of different types. So they're things like just going for dinner or drinks. Sometimes we do activities like axe throwing and flight club, so playing darts, and they're always a lot of fun. And we've actually got one organised for tomorrow here in London. Another thing that we offer is regional group support. And again, this is where we've split the country into 11 different regions, and we have a regional manager who organises meetups within the local area for people to meet others that are close to them. As well as that, we offer a one-to-one support service, which is something that we want to expand on. And this is where young people can reach out to a trained mental health first aider. We also have a strong social media presence, a website for information, and a newsletter to keep our community members up to date. So what we've achieved so far. So I just wanted to go through a few highlights. So between 2019 and 2020, so from when we were founded, we saw a huge growth from something that I didn't think would be, a big thing. We grew to around 200 people in the first year. We hosted weekly virtual events, and we supported the community through the pandemic. In early 2021, we won a National Diversity Award, as Vanessa mentioned, and that was really when we saw a lot of growth, and we realised what an impact we'd made for a lot of people. At the end of 2021, we became a registered charity, and between the end of 2022 and start of 2023, we received some national lottery funding for startup costs. In February 2023, we did our first national fundraiser. It was called Move Together for MS, and it encouraged young people to get active whilst also raising money for MS Together. In April, a highlight was definitely MS Awareness Week. We worked with the 6 other big national MS charities on a campaign called MS Makes Me. And definitely the highlight for September has to be today. Since then, I'm also incredibly proud of the hundreds of virtual events and in-person events that we've hosted across the country. But I guess our biggest highlight is always hearing from our community. So here's just a few testimonials for you to read. So I guess that tells you about our success so far, but one of the main questions that I still get asked all the time is, why do you focus on people aged 18 to 35? Over the next few hours, I think it will become clear, if it wasn't already, why dedicated support for young people with MS is needed. But I just want to tell you a bit more from my point of view. So when I was first diagnosed, I got involved with a number of different charities and other MS organisations. And one of them helped me to meet other people with MS. But the first MS meetup I went to, I was the youngest by more than 30 years. One of them let me connect with people online, but it wasn't UK based. So I found a lot of people talking about topics that didn't relate to me. One of them provided the online support network that I was looking for, but it was open to anyone affected by MS. And it ended up being a very negative and hostile environment. And a few of them helped me through their information and support, but I didn't see much representation of young people in their leaflets, on their websites, and on their social media pages. And it's not just me who's experienced this or felt like this. When I first set up MS Together, people would thank me and say, this is exactly what I needed when I was first diagnosed. And even now, almost 4 years later, people still say the same thing. As an organisation that was set up by young people for young people, we understand that between the ages of 18 and 35, people go through huge milestones in their lives, such as going to university, travelling, starting work, changing jobs, getting married, having children, and so much more. Of course, there's never a good time to receive an MS diagnosis, but when you're also dealing with so many life events, an MS diagnosis can completely turn your world upside down and make everything more difficult. The point of MS Together is therefore to provide a safe space for young people to ask questions, to connect with people like them going through similar things, and to get the support they need when they need it. Many of the existing MS charities and organisations do brilliant work for the MS community, and we do not wish to replicate their work, but instead we hope to fill in the gaps that exist for young people with MS. So, we have lots of exciting plans for the future to grow, reach more people, and expand our services. Just to name a few things without giving too much away. So we will be expanding our one-to-one support services, and that will be through improving our current one-to-one support service and also creating a new support offering. We'll also be hosting additional events to enable more people to connect, and that will be virtually through more webinars and also more social events, because they're the fun parts. And finally, we want to work with healthcare professionals, MS organisations and specialists, and people with MS to develop online resources to help people better understand and manage their MS. We know that different people need different levels of support at different times during their MS journey, and we therefore want our services to be as inclusive as possible so that we can provide something for everyone. The overall plan is therefore to provide a tailored support network where we have different tiers of support that people can access at different points in their MS journey. And the ultimate goal is to be the go-to charity for anyone aged 18 to 35 diagnosed with MS.
Fantastic, Amy. So next up, we have an opportunity to listen to 2 healthcare professionals in conversation with each other. Now, what I would say, we have a real kind of mixed distribution of people in the room, everyone from MS lived experience to, say, healthcare professionals to friends and supporters of those with MS. So After this particular session, there's an opportunity for us to ask questions. So let's not leave the silence. So get ready for that. You can do that through Slido as well. And I think, Amy, we've got a slide with the Slido code. But I would also invite the people online to use Slido as well to ask some questions. So without further ado, I would like to introduce you to Dr. Niraj Mistry, better known as Nij to us, to join me up front. He's a consultant neurologist at Queen Elizabeth Hospital in Birmingham. I'd also like to introduce you to Ruth Stross, sorry, get my words out today, who's head of nursing at the Neurology Academy. Over to you.
So I'm hoping that this mic works, otherwise I'm going to stand behind the podium. Yeah, good. So I can just circulate now, we don't have to fight over this. So I won't reintroduce myself, but just for ease, feel free to just call me Nij, that's what I call myself. I've been instructed to tell you about what MS is, but I suspect most of you have a pretty good idea about that already, so I'll keep it brief. If anyone's got any burning questions, because there was gaping holes in this talk, there's a Q&A after this session. If there are any really difficult questions, I'd just like to point out up front that there's at least a couple of world famous professors in the room. I'm sure they don't mind heckling. So, and we have got a roving mic, just saying. Yeah, there's a few colleagues, isn't there? But we'll do our best. So, look, what is MS? Just in brief, it's where your immune system seems to think that it's got nothing better to do and decides to attack bits of your brain or spinal cord. So that can include the optic nerves or any part of the brain or spinal cord. And the trouble is that because almost everything in your body is wired up to the nervous system, it can cause lots and lots of different symptoms. On this slide, which I like this cartoon, but it's a bit old, 2016, please ignore the bottom corner. The treatment bit's out of date, and we'll come back to that later. But the trouble with this is that where the immune system's triggering patches of inflammation somewhere in the brain or the spinal cord, it causes problems where the inflammation lasts for a few weeks. But then even when the inflammation dies down, it can leave a scar, and the scar can always play you up, especially on a bad day, or if you're hot, or if you're tired, or if you've got the flu, or if you've got COVID. So when the scar plays you up, it's going to be in a familiar way, like an echo of the original relapse. So common signs: fatigue, cognitive impairment, balance problems, funny feelings, pins and needles, vision problems. But the difficulty is that it can be almost anything. And remember I said that scar left behind can play you up on a bad day, or if it's really in an awkward place, it can play you up every day. So what we'll get onto in a bit is that the whole point of what we want to do about MS is prevent people getting the scars in the first place, which involves early effective therapy. So we'll talk about that in a bit. One of the questions I anticipated might be on what is the cause of MS, which is a good question. Now, I could trot out the usual, it's a complex interaction of genetic risk factors and environmental factors. I won't bore you with that, you've heard it all before. Of course, there are genetic risk factors. More are discovered all the time because the genetic science and technology keeps advancing. Each new gene confers a bit of extra risk, but it's not a straightforward genetic disease. There are risk factors in the environment, so vitamin D deficiency, childhood obesity and smoking don't help. And if you keep smoking with MS, you can make it worse. But if you want to know what the closest thing is we know about to a cause of MS, it's this Epstein-Barr virus. Now, most of us encounter Epstein-Barr virus in some point in our lives. And for the vast majority, it lives happily ever after in our B cells and doesn't cause any trouble. And we don't really notice any issues from it. But Epstein-Barr is a prerequisite to be able to develop MS. And apart from a few exceptions in pediatric MS. And you can't otherwise really get MS without it. So the way I would see it is MS is a rare complication of Epstein-Barr virus. Don't worry if you've had glandular fever doesn't mean you're definitely going to get MS. It's a rare complication of Epstein-Barr virus. Okay. So I'm going to let Ruth give us some interesting statistics from the MS register.
Yeah, thank you, Nid. Hi everyone, and thank you, Amy, for inviting me here today. So very much thanks to the UK MS Register. They've come back with, we went to them with some questions and some thoughts for today. And actually within a very short period of time, they came back with some of these graphs and some of this evidence for us, which we felt would be quite helpful. So, what we were looking at is that what's really interesting is the average time from onset to diagnosis has decreased in recent years. And that's really kind of what we're doing within our work. So I've been working in MS for about 20 years, and we'll go into it a little bit more in a bit, but we've seen a huge change in how MS is managed, from not really being managed and very much reactive management to a lot of proactive management. So hopefully that's being reflected in these statistics. One of the things that's quite interesting is MS is a young disease, as Amy's been talking about, and 93% of people with a new diagnosis are of working age. That means they're under 65. So what's really interesting is that, and it's something I was talking about at a conference yesterday, actually, a lot of the papers that we read as healthcare professionals are not necessarily showing that over the last 20 years, that kind of time from diagnosis to leaving work has elongated. So we've always been saying 3 to 5 years from diagnosis to leaving work. But obviously over the last 20 years, we've seen this huge change within disease-modifying therapies, disease-modifying lifestyle that we're talking about. And so when this was, so we asked the MS Register particularly around this, and actually it does say that the percentage of people in paid employment is rising from year of diagnosis. So if you look at the amount of people that were in paid employment, and now actually for the people that are diagnosed with MS, we now have a much larger percentage. So that for us is really exciting. And people are much more likely to report they are in work. Yeah, which is a lot of what we are doing in our roles. One of the things that I would say we are going to sort of touch on, and Amy, you mentioned about this, there are obviously the impact of having a diagnosis of MS, especially when you're younger and you're dealing with all sorts of other things at that age, and there's huge changes for yourself, there's changes within your family, with work, and all of these things. There are 2 of the 5 most reported symptoms that have been reported on the register are fatigue and cognition, and obviously that then leads on to poorer mental health. So one of the things that was concerning is that as a younger person, there is more likely to be an effect on your mental and mind health. So one of the things that both Nid and I really felt was important about today is that we need to highlight that, because actually do talk to healthcare professionals, because we are responding differently. There is a lot of support, and we will mention a little bit about that now. And obviously something like MS Together is a huge support. So that's something that we know that the NHS is not going to suddenly change. We know that there's not going to suddenly be all these services that we would really love to see. But in the interim, it is being highlighted, and there are places that you can go to for support. So although that is something that is something that you see in younger people, it is something that if you get together and talk about, there's a lot of evidence that actually that makes a difference. There's a really good paper that Gavin often talks about, talking about hope and resilience, improving grit. And if you get together in groups with peer support, that can bring hope. So yeah, do reach out and talk to other people. So I guess one of the things we talk about is what hinders engagement, and I know that you'll have all had your own experience, either as people with MS or you know, even as a clinician, we've had our own personal experience within the healthcare system. And sometimes you don't like to say things because you don't want to affect that relationship. You don't want to be labelled as difficult. You don't want to kind of come across as someone that's being awkward. So often we can take a passive role, and that isn't necessarily easy when you then want to actually try and make changes. You want to be more actively involved. And I would say that a lot of the way that we will talk about now, that a lot of MS services, and I'd like to think that kind of goes a little bit across the NHS, we have really changed in the way that we are helping to manage people. And I think that the one thing that is within the transformation plan is very much around looking at patients as partners. I know that sounds like spiel, but essentially I think it really is coming through. I think there's a real change that we are actually listening and hearing, and you know, making sure that we then affect change within our services. But obviously, if that isn't the case, then please feed back to your own services and let them know. Do you want to do this?
So I'll take over from here. Now, the picture on the right there is obviously pre-COVID. We can't fit that many medical students into clinic rooms anymore. It's just not a good look. And it's definitely not Birmingham Medical School, because half of our intake at least is female now. So I think this is from Paris, probably. But I think the point I was really trying to make here is that things have moved on in most places, hopefully. We think they're out in ours. I think that the model used to be very paternalistic and reactive, but I think we're trying to move to a more proactive and collaborative approach. So I normally will make the person with MS drag the chair around to look at the blobs on the scan, so I can point to them and say, well, I can't count them, but you know.
And that's actually a really huge change, I have to say. I think that for me as an MS nurse is something that we've been trying to really affect change, and it really improves understanding of why we want people to go on to treatment, and also likely to be adherence. I think if you're not really involved and you can't see what's going on, especially when symptoms resolve, it's really helpful.
And I like to think I'm not old enough yet to just tell people what to do. But also I don't think people will do it. I think people have to understand what the point is, so that it will make them understand what the pros and cons are. And I think it ends up having to be a joint decision these days. And it's so confusing now, isn't it? Which we'll talk about, because there's so many options.
Yeah. So I think, you know, you were talking about paternalistic, and I mean, that's where we've come from. That's very much where actually the evidence says that there was quite a lot of poor adherence to treatment. And I think a lot of those stories are still coming out. People tend to discontinue. We didn't know that they discontinued, because actually they discontinued and disengaged and then weren't seen again in the NHS. And we are finding that has happened for some people back, you know, were diagnosed back in the 90s, and they're coming back in now. But I would like to say that is not compatible with shared decision making. So on the next slide, it will show you what I'd like to think that we're moving towards, and we're not there. And obviously, you know, things are different in geographical locations, but we are really recognising that it is very much a kind of a collaboration, and this is something that needs to be a joint decision. We need to recognise that the people we're looking after obviously you are individuals, but essentially you're coming in with your own story. So when we see you in clinic, there's been a whole load of things that's been happening beforehand. And then when we see you for the, you know, 15, 20 minutes or whatever it is, some of us are lucky to see you for a little bit longer. And that's just a real snapshot. So because of that, you know, some of us have brought in various different ways to manage that. Sometimes you might have your clinic will ask you to fill out a form that you can then write down some things that you've got questions on before you come in. And that's partly because we want to make sure the time you see us in clinic is actually what you'd like to talk to us about. And that helps really identify what you feel is important for us to discuss. And this just highlights some of that. Is that the women's health? Yes, so there's a women's health strategy for England that was came out last year. There's a women's health ambassador, and they're very much looking at women's health from birth through our life. And that's because essentially the NHS was built by men for men, so that actually they're looking at various stages. And as Amy's already said, that through 18 to 35, there's a huge amount of change in a woman's life. So excitingly, they have a sort of 10-year plan. We're doing some work, so I'm working with Public Health England and the Menopause CRG, and we're looking at various aspects of that. And I would say lots of colleagues that I've seen in the room are kind of supporting that. So that there is a lot of change. One of the reason I met Nij, we did a MS Leaders Academy masterclass about 2 or 3 years ago. And one of the things that we came out with was this Esther story, which was really trying to work towards everything in one place. So anytime, anywhere, anytime, any place. So that essentially, wherever you are, there is some way for you to access a service, and it's something that is easy for you to access and get a quick reaction without it being very difficult and geographically different. And then if someone leaves the service, it's very difficult sometimes to see what happens next. So we wanted to sort of reduce all of that variation and make sure that the standard is the same. And I think there's a lot of, that's essentially it.
So one of the other changes that is happening, hopefully in most places, that we're getting quicker at diagnosing MS, and various tests are available. As most of you know, there's no single test that is diagnostic for MS. It's still a clinical diagnosis. But the thing that's really helped is the use of MRI scanning. MRI scanning technology has improved, but I think mainly what's improved is the way that we're using MS to get to a sooner diagnosis. So I'll show you the next slide, but please don't memorize that. The point about this is that whatever you think of those diagnostic criteria, they're a lot simpler than what they used to be. And the whole point of having simplified diagnostic criteria is that you can tick the boxes sooner to have a confirmed diagnosis sooner. And what's the point of having a confirmed diagnosis sooner? Well, it's so that you can get to treatment sooner rather than later. So I think on the next slide, what we can see is what we all probably know already, is that the sooner you get onto high efficacy disease modification therapy for your MS, the better it is in the long term. And if you delay high efficacy therapy too long, then you never quite get back what you lost compared to had you gone on high efficacy therapy at the beginning. So the whole point, as we know from the brain health document as well, and all the data that keeps coming out, is high efficacy therapy sooner rather than later. And in order to facilitate that, you have to have a confirmed diagnosis in the first place. And this is where we're reaching a kind of zenith in early treatment. So this study called Attack MS, based here in London, based out of Barts, run by Klaus, who's just sitting over there, if anyone's got burning questions, but also there's an email address on there. This is a study that's planning to randomise patients who have their first ever attack of MS onto treatment with natalizumab, which is a high efficacy IV therapy, within 2 weeks of the onset of their first ever attack. And we are recruiting for that throughout the country if you're willing to travel to London for the study protocol, right? He's nodding, I think that's correct. Great. And so apologies for this slide being a bit American, but it was a reasonably up-to-date one. The point here is that the number of disease modification therapies for people who have MS has gone through the roof in the last couple of decades. There are so many choices now. The newer treatments tend to be more effective than what we used to have as well. And what it looks like really is just a minefield of bewildering different choices, I think, from a person with MS's point of view, if they're brand new to all this. And I think part of the collaborative approach we were talking about earlier is we have to act as a useful guide through this. Otherwise, you just feel like you're abandoned and left to your own devices and nothing makes sense.
Yeah.
And it's not just treatment for people with relapsing remitting MS. We're starting to see the first of a crop of treatments being licensed now for people with progressive forms of MS. So this was the first licensed therapy for disease modification in primary progressive MS in 2019 and 2020 for people with secondary progressive MS. So I think the point here is that finally we're starting to branch out of the realms of just disease modification of relapsing remitting MS. Now, for people starting with relapsing remitting MS now, exposed to high efficacy therapies that didn't exist 10 or 15 years ago, we're entering relatively uncharted territory, aren't we? So we don't really know what's going to happen in terms of delay or avoidance of onset of secondary progressive MS, because those drugs haven't been around for long enough for us to know what comes out the other end. What I would say is that if anyone gets to that point in whenever it is, 10 years, 20 years time, I think when we cross that bridge, if we come to it, things are going to look a lot different to what they are now, because they're starting to change already.
Yeah.
And we're also looking beyond just treating to suppress new lesion formation and enhancing lesion formation and relapse activity, because we are recognizing, better late than never, that there's more to MS than that. And there is a clear contribution of progression independent of relapse activity to the total cumulative disability in the long term for people with MS. And these graphs are saying what I just said. Even if you're on a high efficacy therapy, the larger proportion of confirmed disability worsening at the end of the count at 96 weeks is contributed to by non-relapse activity, right? So why am I bothering to tell you about this? Well, the point is we have to recognize it first if we're going to do anything about it. And there are things coming, so don't worry. And I think that's on the next slide. Because we are looking at new classes of drugs with novel mechanisms of action. And what's reassuring is that this, I hope, is going to be the first of a new wave of therapies that really act in a way that we haven't reached in MS before. And as well as new types of therapies and new mechanisms of actions of therapies, we are starting to branch out in terms of more different study designs. So I presume that the Octopus study design was inspired by what we were able to achieve in the NHS during COVID, with very rapid parallel arm studies that interrogate the efficacy of multiple treatments across thousands of patients to achieve a useful answer quickly, which worked so well during the pandemic. So here we are. I think that every cloud has a silver lining, right? I don't know if this would have happened otherwise. So Octopus MS, I think, is soon to be recruiting. If it's not already, we're not a site yet.
I don't know. I thought it had started, but it is recruiting. I thought it was.
And Chariot MS, which was the other badge on there, is a trial that we're also participating in Birmingham. And I think that the important point here is that for the first time, we're looking at giving disease modification therapy to people who can't walk, so they're in a wheelchair mostly, but we recognise that they're dependent on the function they have in their arms, and we would like to still treat to be able to preserve that.
So after all that, I just wanted to say, so from my point of view, I worked on a neurology ward in the early 90s, and I just want to really reiterate that the management of MS has massively changed from that. The whole picture there was absolutely none of these treatments. There were no disease modifying therapies. There was nothing. It was very, very reactive. It was very much even kind of quite basic symptom management. A lot of the things that we see now didn't exist. And that change is huge, that we have moved from sort of say 91, 92 when I was on the ward through to today. So there are better outcomes. And alongside disease modifying therapies, it's very much one of the things that we talk about, and it isn't just words, is disease modifying lifestyle, healthy lifestyle. And you'll have probably seen a lot of people on LinkedIn and social media. Dr. Agnes Straukiena has Be Well with MS. Is she here? Hey, Agnes. And there are, as Amy's already alluded to, there are other charities, and I completely agree. I think that what MS Together have is that for the younger people, but what's lovely is that the MS charities work really well together. So there is One of the things that I would say with the symptoms, which Nij mentioned earlier, is there are a lot of invisible symptoms, and you talked about it as well, Amy, and that's the part that we're always trying to educate other healthcare professionals, so people we work with, and also your families, and kind of trying to support you with that element that it's really difficult to tell work, to tell friends and family, for us to train up other healthcare professionals that you're involved with. So I do think there's been a real shift. There are some of the charities that are particularly looking at healthy lifestyle. There's a lot of information out there. And I think one of the things that we tend not to do is give you too much information at the beginning, because essentially we don't know what it's like to have that diagnosis, and we really want to support you with your individual journey. That is slightly changing with things like Attack MS, where, you know, we would like some decisions to be relatively quick, but essentially you're always in control. It's your decision. And I think that's what we really want to have moved towards. One of the documents that's really that came out in August 2022 is optimizing brain health across the disease course. That has come from the World Health Organization, and that talks a lot around what their ideas are for the next however many years, but as a global effort. So I guess I just wanted to reiterate there are massive changes, and it seemed to be, whether people had lots of time in the, you know, a couple of years in COVID when we were all isolated, but there was quite a lot that came out last year that has been, you know, I think really helpful for us moving forward. So disease modifying lifestyle, you'll find out lots of information around that. And I would like to think that a lot of the invisible symptom management is becoming a bit more visible. We're upskilling as healthcare professionals. We're building our confidence to ask you questions around that. And if you feel that we're not, if you feel that people are not asking you whatever it is you want to be asked, then please tell them, write it down, send an email, just tell us, because honestly, we want to know. We'd much rather hear and make changes to our service. So I guess transformation of MS services, it isn't happening overnight. It is taking a while, but there is a lot going on. So this image at the top here, this is all the integrated care boards. The terminology within the NHS since I started has changed from PCTs to CCGs to ICBs. They like their abbreviations, so they like different ways of doing things. Essentially, it's moving where the funding is, who's in charge. And it hasn't made it easy for us, because sometimes within services you can make a lot of change, but that doesn't necessarily mean you've recouped that funding and you can benefit your service directly. So we are learning, we're very much learning how we can do it better. But last year, Dr. Nirmal Anthem has been appointed. So he is a consultant neurologist that works at St George's. So I work across Surrey, and I've met him and worked with him. He's been appointed as the National Clinical Director for neurology. So he is sort of heading up the national picture, working with other colleagues that I know, and they are looking at the transformation plan from the NHS. And I know that there are people there that are particularly talking and sort of, you know, putting their hand up and asking about MS services. This one is looking, so within MS services, historically, we've really worked as hub and spoke. So we've had like the regional centre and then spoke. So it's essentially people are not really communicating, they just communicate with the hub, the kind of the bigger centre, rather than the district general hospitals. And that's really changed. So in Surrey, where I work, when I started back in 2017, we had no MS neurologists working in the DGHs. Now there is one in every hospital, bar one hospital, and they were there, but they moved. So we have seen a huge shift. So we have that expertise at the local level, and that means that we're able to prescribe these drugs in the local area, which is really exciting. So we are moving towards networks, which essentially means that wherever someone pitches up to be seen in the NHS, they should get treated the same. That's what we want to move towards. That map is just showcasing on the MS Trust website all of the services that are available, and excitingly, there's a lot more. There is a group called Transforming MS for All that are doing a huge amount of work to improve MS services, and we've really moved from paper. There's no faxes in the NHS anymore. We have emails. We ask patients to sign an email consent form, and then we can just email. So we know you're at work, we know that people are are busy, they have families. We don't want you to be sitting on the phone or trying to get in touch with us. So we get details on email, and then we can respond to that. So I think a lot more mutual respect for time. This is just, we are talking about care pathways within the NHS and within MS. There is an optimal care pathway for MS. That's a national one. And then the next one is more around specific. So we have specific symptom management pathways, and I've put some in place in Surrey. So that is basically trying to, again, standardise care, reduce variation. So we want a national picture, and then we want to all be doing very similar things with slight, obviously there are slight nuances to local areas, but essentially we want people to be receiving the same care when it comes to MS and the same access to treatment.
So we've talked a lot about what's changing in MS, haven't we? And you might now be wondering what the point of any of that was, or what it's got to do with MS together. But we do have a point, and the point is that their management of MS and the experience of MS has changed completely in the last 20 or even 10 years. So for a young person starting with MS now, the experience is so different that a lot of the care services are not catering for that anymore in the way that they should be, because they're still catering for what MS used to be, right? And I think that, like you said, there are a lot of good NHS services, but it's probably a bit patchy, and there is an unmet need, some more than other places. And I think that's where MS Together can really help. So I hope you agree that there's an unmet need, things have changed, and that's where we can fit in. So thanks for listening.
As well. So does anyone in the room want to ask first question? Gentleman at the back.
Just on the speeding up diagnosis and with Attack MS, things like that. One of the things I've noticed quite a bit is when people are diagnosed with something, so I know vision problems are one of the most common first symptoms for young people with MS. So I think what I saw was like between 18 and 25, particularly more with males than females. So that was my story. I got double vision when I was 20. I went through Moorfield Eye Hospital. I had endless eye tests. They looked at my optic nerve. It was weeks and weeks and weeks. I was working in Stratford during the Olympics at the time as well. So not fun seeing double of everything when it's like the most busy environment ever. And what I was basically told at the end of it was, it's probably growing. It's probably because you're a growing boy and the muscles in your eyes are adjusting. I didn't buy that at the time, but it just resolved itself. And then 10 years later, I get left-sided paralysis and get an MS diagnosis fairly quickly. And when I asked these questions about, well, that double vision that happened when I was 21, nobody mentioned anything about neurological being a consideration. Why was that? And all I was told, and by friends who I know who are doctors as well, well, it's a secondary symptom. It's secondary, so it's not going to get picked up. I didn't understand what that meant. If you're running Moorfields Eye Hospital, you surely must know that a certain number of your problems are being caused by a neurological condition. What's being done to kind of address that and upskill people outside of the neurology faculty to pick up that actually it might not be something to do with me, it might be something to do with my colleague? Especially just because you met, was it the new chair looking at this was based at St George's, and it just rang a bell because Moorfields have got an outpost there. So I just thought, God, you're literally next door to each other.
And the other thing actually is going back to the pathways. We are very much looking at the diagnosis pathway. So one of the things that is being discussed, and I think is used in some areas, is what's called the RAG system, so red, amber, green, so that actually it's upskilling our colleagues in primary care. So I've worked in specialist centres, and I've now, my last two posts have been in the community, which you end up with a much better relationship within primary care. So I've been able to go into the meetings where, 30 or 40 GPs and talk to them about MS and talk about diagnosis. And then there's been a lot of discussion around what are the red, what are the symptoms that should be an absolute referral, amber and green. So I would say mapping pathways is absolutely crucial to that, because it's about the personal experience, what's gone wrong, and then how can we address that.
And I hear what you're saying. It's a very familiar story, very reminiscent of what you said, Amy. And I think that it's all too common, isn't it? I think that we're very good at talking amongst ourselves and polishing our own criteria. But your point is, it needs to be a wider message. And I think that's why things like the brain health document and the optimum pathway are so important to educate a wider audience. And I think that's why promoting studies like Attack MS is so important, to say, well, the point is you can get earlier treatment, right? And earlier treatment affects outcomes. So we all know that. And I think any avenue we can use to spread that message, and whether that's MS Together or anywhere else, well, everything helps,
So I
doesn't
think
it?
the integrated care board meetings, they're open meetings, so you can attend, and if you're there, you end up talking to people that are making decisions like this. So just tell them that the personal experience is huge. If we go in to talk about anything we want to make a change within our services, if we're looking at business plans, it's that personal experience, it's bringing the case study, but bringing the actual person with us, because that does make a difference. So
Just a quick follow-up question, bit of a difficult question, but in your opinion, do you think, say, for instance, ophthalmologists not being so ready to refer someone for an MRI has anything to do with us having the lowest number of MRI scanners in the NHS per person in Europe? If
It
MRI
might
scans
be-
were more available,
yeah.
would we be more ready to just send
Yeah.
people for a scan just in
It's a
case?
chicken and egg question. Maybe if there was readier access, it'd be a shorter threshold to referral and scanning. I guess maybe we need to do both. We need to educate and make access easier, everything. And not just ophthalmologists, primary care, like Ruth said, across the board. So we'll keep chipping away from our end and you go for it, and we'll just do a sort of pincer attack.
Any other questions? And for those of you, this link over here, for those of you that are online, you can go to Slido, and the letters that you need to put in is MST. So please, let's have some questions from online as well. But over to you.
Thank you. Testing. So I've been diagnosed for nearly 5 years now, and been part of this group this whole time, which I'm very grateful for. Just a little bit of a backstory on mine before my question. I was on Tecfidera from initial diagnosis for 3 years. That was really great. It was, my MRIs were coming back, no progression. I was doing really fine. So in that stage of my life, I decided that I wanted to start for a family. So I went on to Copaxone, had that, and so I was pregnant, taking that. Then after I had my baby, which I won't go into, but I sadly lost her, so it's a stressful time. But I then became allergic to my injections, and I've been off medication for now. Sorry, I just hate talking about it, but my question is, because I had a confliction when you were talking about being off medication, and I've not been on medication for a year now because I became very allergic to Copaxone. So when I had my baby, I was injecting and I'd have flu-like symptoms and throwing up. And so now, like you were saying, like with women especially, you come into an age where that time of your life where you want to have children and the options. And I think the difficulty I have now is, okay, so I want to have children, but there's not many options of the medication available, you know, safe because of the research. But my doctor said to me recently, my neurologist, that it's okay if I'm on a gap for a year or two. Now, I just want to hear what your opinion is on that, because I've been through a stressful time. And he said, you're doing well. But then when I hear about the drugs and how important it is to be on them, you know, what's the opinion on having that gap to...
But before Nij jumps in with the science, I just want to say thank you for sharing your story. That's really difficult, especially in this forum. And if
So
you want to
nice.
chat off, if you do want to catch up afterwards, then I'm really happy to chat. I'll let you answer that.
Yeah, so thanks for sharing such a difficult experience. And I think that actually this is of wider relevance potentially to lots of people in the room as well. So thanks for that. And I think that what you're highlighting here is what we were talking about, is that things are changing so rapidly. My own practice has changed quite a lot in the last, well, I started doing MS in 2016. And I think that in this country, we're quite lucky that the MS neurology and allied health professionals have clubbed together to devise a set of quite sensible guidelines for use of effective disease modifying therapies up to pregnancy and during breastfeeding if necessary. And in our trust, if we're really worried about someone, then we'll on an individual basis make a decision to continue high efficacy therapy even during pregnancy. And as long as we monitor closely enough, it's a safe thing to do. Now, the drug companies' labels won't allow us to do this or that because the labels are understandably risk averse, but because we've got guidance, we do have options. So all I would say is that you have options based on the ABN guidelines, and I think your neurologist probably knows about them by now.
Yeah, it was more that he said there wasn't many options, and because of the allergic reaction I had to Copaxone, that if I was thinking of having a baby again anytime soon, that they might all have that adverse effect. So my options are sparse. And then the anxiety creeps in of the longer I'm not on anything, you know, you look at the data and that's where a new anxiety creeps in, where it's how long should I be off them? When should I? Because I'm an advocate for taking the medication, absolutely, and I do agree with everything, and you know the facts and statistics are there. But it's more, you know, I've been off for a year, you know, almost what's next in terms, because you want to maybe start your family, but there's not the options, and or am I okay in having that break? I mean, we don't know. I know you can't answer that. That's really hard to answer. But yeah, like, what's the opinion on taking a small break if, you know, if it just, is it going to have that real knock-on effect, do we think, or?
What you're highlighting is the complexities around this conversation.
Exactly, yeah.
It is, so Ruth Dobson's done quite a lot of work around this decision. There are guidelines for healthcare professionals that she has written. And as Nij said, there's a lot of upskilling of MS colleagues. I think that we are still, across the whole of neurology, there's still quite a lot for us to learn. So I think it's going back, as you said, to have that conversation with your local team and involve the MS nurse. We're good.
Yeah.
We don't want to seem cagey, but without knowing the nuances of your individual case, we don't want to be too
No, I know.
prescriptive.
No, I just thought it's an opinion if anyone took a break, or, you know, just this, yeah.
But I
It's
think
so
you
personal.
certainly have options.
Thank you.
We've got time for another question. Thank you. This lady over here, and then did I have someone over here? That way? And then I'll come back to you.
So my question is more around how people get their diagnosis. So for me, I knew I had MS, but basically, and thankfully I had somebody who could tell me what my results were, but I just got a letter through that was like confirmed diagnosis through my door, which I think is very impersonal. And it's a huge thing that you're being told, you know, it's life-changing. I was just wondering what sort of influence you have or view in terms of passing that down through to neurologists saying, you know, for me, a letter is not okay. So making it a bit more, even if it's with a nurse or somebody else, just in person, I think that's something that needs to be looked at.
Yeah, absolutely. And I'm really sorry that you've had that experience. It's absolutely not okay. So the Neurological Alliance, who are a national group with CEO Georgina Carr, during COVID, they published a document looking at particularly at this area. And what they highlighted, there were people getting texts with a diagnosis and other ways that are obviously not okay to receive a diagnosis. So that really did highlight it as a national picture. And she's done quite a lot of work on social media and also going out within the NHS. There is a group that she heads up that has all of the a lot of sort of leaders within the NHS and also charities. So then there's access to kind of healthcare professionals and also supporting people that received a diagnosis. So we aren't getting it right all the time, but there are changes.
And I think that the unfortunate part of your experience is that I'm guessing you probably went on the internet a bit, started to think the worst, maybe found some dodgy forums, I don't know. But if you'd have been in front of an MS specialist of any sort when you were given that news, at least one of the first things you'd have been able to hear is that you probably have a lot of options and there's so much we can actually do about it now, rather than just going to thinking the worst. So sorry about that.
And actually that highlights the importance of a group like MS Together and the other MS charities, because actually we have waiting lists in the NHS and there's things that we can't control. We're not going to suddenly get a lot more staff. So that's where we are really reliant on that support that's coming from the charity sector. And I think we work really well together, and I do think that's changing. So, and again, it's telling whoever your local services are and notifying, you know, commissioners within the Integrated Care Board. If you feel like you want to tell your story at any point, write a letter, let them know.
Fantastic. Okay, we're going to have one more. So to this lady here, please. Sorry.
My question is kind of similar to Lauren's. So 3 months after my MS diagnosis, I got diagnosed with bowel cancer. So they made the decision not to put me on any DMTs. I'm monitored annually for the MS, and thankfully there's been no new or active disease. But my concern is that I'm obviously not on a DMT, and they're very reluctant to put me on one because of the previous cancer diagnosis. Is there options there for me?
So a lot of the high efficacy therapies we use now work by messing with your immune system, and there's no way around that because it's your immune system that's provoking the new lesions and the relapses, right? So the specific information we're given from the companies, understandably, is that a lot of these medications can't be used if there's an active malignancy. The reason they say that is that the immune systems are part of your body's surveillance system for cancer cells. And if we hammer your immune system too hard while there's an active cancer, your body's ability to fight off that cancer in conjunction with chemotherapy or whatever is going to be reduced. And that might affect your cancer outcome. Now, you can't just concentrate on one thing and ignore the other thing. There's going to be a balancing act, isn't there?
Yeah, that's just been removed.
Yeah. So if you no longer meet the definition of active malignancy, you're not meeting the hard contraindications for a lot of these therapies. And if you were, there might also be less drastic options. So I think there's probably levels of approach, one of which might be suitable to your team. But again, I think the answer I would give you is very similar. I suspect you have options. There's no one size fits all approach, but I think talking it through might get you to the point where you might all be able to agree on something that suits you.
I would say, yeah, I mean, coordinating all of those healthcare professionals is tricky, isn't it? And so we've had some experiences similar to that, where we've had emails that have gone between neurology on, you know, all of the different areas, and that's really crucial to just make sure that they are all very much aware of each other.
So we're going to close this particular panel. So thank you very much, Ruth. Thank you, Denise. So without further ado, moving on, we now have a panel. It's a lived experience panel. So I'd like to call Rosanna, who's going to introduce her guests.
Hello.
You can turn them on.
Yeah, perfect. Thank you so much, Vanessa. So my name is Rosanna, and I'm going to be joined shortly by Bayan, Cressy and Mia, if you'd like to come join me up here. And we're going to talk a little bit about what it's like to be a young person in the UK living with multiple sclerosis. So please welcome Mia, Bayan and Cressy. Maybe we should have sat in order of our pictures, but hopefully you can work out who's who from the pictures on the screen that you can see behind you. So I'm going to kind of skip the intros because our names are on the board, and what's brought us together is the fact that we're all young people living in the UK with multiple sclerosis. And I'm going to jump into talking about like why MS Together has been helpful for us. That's how we've met each other is through this wonderful group. But like starting at the beginning, and I'll start over with Cressy, if that's okay. Just how did you feel when you were first diagnosed with multiple sclerosis?
At the beginning, when I first was diagnosed it was a long process to getting diagnosed. I was having symptoms back in 2018, but I didn't get my final diagnosis in 2019. it was sadness, it was shock. I was at a really low point at the beginning, just because I didn't have anyone who understood. My mum has MS, but was diagnosed a lot later in life. So she's already had us children. And I just felt like life was a little bit unfair. I was 28. I had just found my career. I was an art gallery dealer at that point, which unfortunately I have had to give up and change just because of the amount of hours and effort that took. So yeah, I just felt really low at the beginning. And then after that, I was just anger, just why me, and just not having anyone really to relate to. I just found that really difficult at the beginning.
Yeah, 100%. And I think a lot of the young people in the room or on the Zoom call who are listening to this as well can probably relate. I think that's a very similar story for all of us. It's a lot of questioning and there's not always a lot of answers out there straight away. Mia, you were diagnosed a little bit younger. Do you want to talk a little bit about how that was?
Yeah, so I was diagnosed at 18, but it's believed by my neurologist that I've had MS since I was 12. But I was put off by doctors for 6 or so years. So I'm quite different in that by the time I was diagnosed, I was so relieved that we knew what was going on. But at the same time, I actually thought my doctor was lying because I didn't really trust doctors. And I'd kind of built up this idea that whatever I had, it would go away. But obviously, that is the relapsing and remitting part of my diagnosis. So yeah, finally at 18, and that's quite a pivotal part of your life. So it's quite difficult.
Yeah, definitely. And I think that might be something that's quite common among a lot of the people in our group, is that we're making so many life decisions, and it also sometimes feels like, you're 18, you have to make all these big life decisions, and then someone's thrown a chronic illness with no cure on top of all of that. You don't really know where you're going yet. Is there anything that you think you could have had as extra support at that point that would have helped?
Yeah, definitely. So I actually never got like a formal diagnosis. It was kind of like in whispers. It was like, we think it's MS, but we'll keep doing tests. We can have a lumbar puncture, but we think it's MS. We'll do another MRI. And then one day I just got a booklet for treatments. So I kind of was like, oh, okay, I'm going to take that as my formal diagnosis. But I think for me, obviously, I was still in school, doing my A-levels. I was just about to move away to university. So I feel like my kind of care needs and what I would have required at the time is quite different, but also quite common. I was going through a massive life change from girlhood to womanhood. I was not a child anymore, essentially, but I was going through such adult experiences. And the first neurologist I had didn't quite understand this idea of like pediatric MS and being a child. And fortunately, I did get a new neurologist, and she really understood that idea of kind of hitting it hard young, and also this idea that I was still learning and still growing up alongside, and obviously making mistakes alongside that.
I think you're allowed to make mistakes. Fine, I'm going to come to you in the middle. How was your diagnosis? How did you feel, and what support did you have, and what support did you want?
Yeah, absolutely. I was diagnosed in 2020. I was 24 years old. It was after a year of symptoms, and I had about maybe 2 or 3 relapses before my diagnosis. So for me, getting the diagnosis, unfortunately, it was by letter due to an admin error. But for me, I finally had a name of what I was dealing with. So it's almost, that kind of sense of relief that now I've got a name for what I'm dealing with. It's not just me that's dealing with this. There is a protocol in place. There is a procedure there. So I knew what I was dealing with, which was fantastic. So it was great. What do I do to get onto treatment quickly to try and slow this down? How do I slow down the progression of this condition? So it felt like a bit of loneliness at the beginning, where you feel like it's just you. You're seeing all your friends kind of getting on with their lives. Obviously, everyone has things that are going on in the background. But I found out about the group through a friend of mine who knew Amy from school, and just by word of mouth, she told me, oh, there's this friend that I have, there's a support group, so you should have a look. And I knew about the group just before I was diagnosed. So for me, kind of looking through the social media account, it was almost like if I do get diagnosed with something, I wouldn't mind if it's MS, because this group actually seems really supportive. It actually seems like the sort of group that I'd want to be a part of for a neurological condition. So yeah, it was almost like a sense of relief because I knew I could click the join the Facebook group button with my official diagnosis.
That's really funny because I actually found out about Amy through a friend of hers. I think someone had gone to school with you. Yeah, it was like that. Before it was MS Together, where there was maybe like 20 of us just on this WhatsApp group. And yeah, friends for life.
That's amazing. I think I would have really benefited from finding MS Together a bit sooner. It took me about a year after my diagnosis and after I'd already started treatment before I found the group on Facebook, just after the Zoom Christmas party I'd missed out on, which I would have loved to join at the time, because like a couple of other people have said already today, it was quite isolating, having a chronic condition during the pandemic and not something that other young people were necessarily having to juggle at the same time. Mia, you talked about your diagnosis, but then how did you find MS Together afterwards? Like Kirsty and Vine have already mentioned, they got in through a friend, which was great.
Yeah, unfortunately, I didn't get in for a friend. I think it was through, so originally it was actually through Amy's blog on Instagram, Beat Don't Kill, and I looked around and then I kind of saw like this little side page, and MS Together had just started, which is exactly when I kind of got diagnosed, but I went through kind of this weird stage of not talking about it. So the last thing I wanted to do was kind of join a group to confront that fear. But once I got over that, joined the group straight away, realised I was actually old enough to join the group. And then there was like this instant feeling of, I don't know, because my hospital had made it out to me like I was this anomaly and there was no one else as young as me, and everyone was as young as me, and everyone was going to uni, everyone had been to uni or having like these kind of, I want to say baby adult problems, like, and I don't know, it was just kind of a click straight away of this is a whole community of people that I didn't even think existed.
Yeah, I think baby adult is a great way to put it, but I'm not sure when I want to become a real adult, but I'm quite enjoying pretending I know what I'm doing as an adult. So my next question, we've talked about like previously so far today, we've heard about Amy's story and how MS Together came to be, and then we heard a little bit from the healthcare professional side of things. But talking about MS Together as really a community of young people, which is what it is, what's been some maybe highlights or a particular part of MS Together that you're particularly proud of or happy to experience? And I'll start with Cressy and then we'll come along the line.
I have found people my own age that are going through similar trials and tribulations and also dealing with MS. So we are kind of, I don't know, this weird family of people from different backgrounds going through the same thing. So I've definitely found my lifelong friends that I still, even when I don't want to talk about MS, I'm still talking about normal everyday things. The charity side as well, I found that to be amazing. We've done a lot of charity walks, and it's not necessarily to raise money for MS Together. This was before we were a charity. We wanted to contribute to everyone else that was struggling with MS. So that has been a great moment as well. But also during the pandemic, as you were saying, it was really lonely and isolating, and a lot of people did find out through letters. I was one of them as well. I had to actually beg them to send me my letter in the post. But doing lots of online Zooms and quizzes and just feeling part of something and not being so scared and alone. Even at 2 a.m, you could always find someone and just say, is anyone out there? Can I message you? I'm experiencing some weird things. And there was always going to be someone at the end of the line ready to answer any questions and things. So yeah, it's a fun little family we've got together, and I wouldn't change it for the world. So yeah.
That's definitely still true. The WhatsApp group doesn't sleep. There's always someone, whether it's MS related insomnia or just getting home after a night out, or someone being up with their kids. Like there's always someone willing to reply on Facebook or on WhatsApp. Brian, what are your highlights since finding MS Together?
Yeah, I think just like Cressy mentioned, the old game of is it just me or is it the MS? Which is really helpful. I think, you know, people would post and, you know, say I'm having this odd symptom, you know, my eyelid is twitching, for instance, and someone else would go, oh yeah, that's actually, I get the same thing as well. Or someone would talk about getting a sort of pain, and it helped verify whether you were actually going through something that was MS related or not. So that peer support really helped. I think also just meeting people across the country during COVID, which was super helpful in terms of seeing that, you know, it's not just me, there are other people in my same situation. I think, you know, we've talked a lot today about how MS is very individualistic in terms of how it affects you in your age group. You know, if you're diagnosed with MS in your 20s, the questions that you're going through in your life are to do with, you know, for instance, how is this going to affect my career? How is this going to affect my relationships, my future? If I'm having kids, how does that affect that? Can I still be a father? Can I still be a mother? So for me, it really helped kind of go through those questions and share, I guess, that common kind of sense of maybe potential loss that you might be going through. But then when you speak to others, you realize actually it's not a complete loss of your future. There's still a lot that you can do, and there are ways to navigate that.
I think it's amazing. There's still so much that so many people can do. And when you're in a group of 1,200 people, you see people's highlights. Like there's a weekly post asking like, what are your highlights this week? Or like, what have you got coming up? What are you looking forward to? And someone's always got something exciting, something positive that they're doing. Like starting a charity for Amy, but everyone else has always got something going on. And it's really nice to have that kind of like positive space, like where we're being very real, but also looking at everything in a positive light. Mia, what are your MS Together highlights?
I would say personally, it would be more kind of reiterating the fact of if you have probably one of the weirdest symptoms, there is no judgment in putting it on there. And it's so likely that not 1, 2, 3, 4, 5, so many other people will have been in that position. So that kind of feeling of like shame, embarrassment just does not exist within that community. And it's just such an open space where you can talk about these things. But I would also say like on another scale, like I was lucky enough to see MS Together win at the National Diversity Awards. And it was so emotional, and it kind of just put into perspective with me that this Facebook group that I was part of is real and it is making this difference. And kind of where it could go from that moment onwards, I just knew that it was just going to grow in scope and get bigger and more powerful.
And we saw some of the testimonials earlier in the text on the screen, and there's been lots and lots more shared on the public Instagram channel for MS Together, and then we see them like weekly, daily in the private Facebook group as well. Like people saying how much it has helped, and it's so good to see the impact that the group has had. I have more questions. Are we doing public Q&A? No, we're not. Cool. I'll keep going with my questions. That's great. No, we're finished. Okay, perfect. Right. Sorry that I can't tell time. Is there anything that you three wanted to say before we finish? Is there anything else that you wanted to get across in your time on the microphone?
Just very quickly, I'd say I think when you look at a lot of work that organisations do, you have to look at the input that goes in and the impact. And I think what MS Together does very well is very high impact for the work that everyone has done collectively. I think right now we're at this unique point where MS Together has become what it has just based off of volunteers and a lot of people with MS helping drive through the work. So it can really skyrocket at this point. But that's what I would say. Not sure if anyone else. Yeah.
Well, thank you to MS Together and to Amy for bringing us all together, and we're so happy that we could come and speak to you all today as well. Thank you for having us.
So thank you, Rosanna, for a wonderful panel. So next up we have Tom Jamieson, who's editor of Able magazine and a trustee of MS Together. So he's the guy behind this wonderful magazine. Please do take your copy. And the incredible Lena Nielsen, British sprinter, hurdler and yoga instructor. So Tom, Lena, would you like to join us? Round of applause, everyone.
Thank you very much. Thanks a lot. Please do take the magazine away, by the way, because there's a super interview with Amy Thompson on page 54. Let's sit down. Let's sit down. Now, here's weird. Over the last couple of hours, we've already done this interview. So we've now got to condense all of the fun we've had speaking together into about 15 minutes, which is going to be strange. But I want to take you back. 13 years old. That's a tough time anyway, isn't it, for a young lady, a young boy, or anybody else? And you get symptoms. What was that time like?
Firstly, can I just say thank you so much to Amy for inviting me
Sure.
here today. This is incredible. I didn't know what to expect coming here, but I actually was tearing up. This is so emotional to be around so many like-minded people, so many young people. So thank you so much, and to everyone else who writes this together. This is incredible. Anyway, what was your question? What was that like? 13?
Yeah. You're 13 and you get symptoms and you don't know presumably what MS is all about. You don't know that you have it. What was that like?
It was a very strange time. I was going through a lot of changes, to be personal. I just started my period. So I thought this was just part of puberty. I had my left arm just stopped working one day. I just couldn't hold anything. And I was like, okay, this is strange. My mum is Egyptian, Sudanese, that's my background, and my surname is Danish, very strange mix. But she's very superstitious as an Egyptian woman, so she thought I was possessed.
Wow, that's something.
Yeah, so she was like, oh, like the spirits have got you. You're right, we've got to fly to Egypt and get you basically exorcised. So that's what we did. We flew to Egypt. Like I had been to a lot of nurses, the same story as a lot of people here. No one believed me. I was 13, and one nurse actually said to me, are you just doing this to get out of school? Because I couldn't explain. I think this table said you couldn't explain what the symptoms were. And I remember saying, I can hold things, but I can't hold things. And I can move my left hand, but I can't move my left hand. Like I didn't really know how to articulate back then. So they just thought I was doing it to get out of school, and flew back home. And then the symptom just kind of resolved itself. And then I was fine until I was 17.
Okay. I mean, I've got to ask, where might MS Together have fitted in for you? What might have changed as a result of MS Together had it been available to you?
Yeah, so I got diagnosed at 17 years old. I had double vision, which is a very common symptom, and then right-sided paralysis. I was so lonely. I'm so jealous of everyone in this room that they have this support group. I'm like, why couldn't this be a thing 10 years ago? But it would have been massive because I said my mum's Egyptian, so there's that language barrier. I didn't know how to explain what I was going through in Arabic. So I was just kind of trying to explain it. I've got a twin sister who actually also recently got diagnosed, very early diagnosis, which is really good. And I couldn't tell her because one of the doctors said to me, oh, so you've got an identical twin sister, so she's most likely going to get this as well. And I wouldn't wish what I went through on my worst enemy. It was awful. And so I felt like it was my fault that she would go through.
I was going to ask you, did you feel guilty? I've seen this before.
It was strange. Yeah, I felt like I was the person who brought this onto our family. So I was like, I cannot tell her, like, I can't scare her because she saw everything that I'd gone through. Like, she helped me do my hair in the morning because I couldn't hold a hairbrush, and curly hair is not very easy to manage on the best of days. So factor in a weak right arm, it's very hard to do your hair. So she was doing my hair for me, and I didn't want her to think that she would have to go through the same thing. So it took me about 3 months until I told her, and she was like, why don't you just tell me? You should have just told me. And then she's been my support this whole time. So she's actually incredible. She's also a professional athlete. So that's hard in itself. And then factor in MS, it's obviously
of course it is. I mean, let's talk about that. I mean, professional athlete, you're definitely the quickest person in this room, right?
I think the person running the mic.
That is true.
Well done. She raised.
But look, I mean, MS, disability, etc., it takes up a lot of headspace. I expect so does your training and regimen and all the rest of it. How do you do it?
I get that question a lot.
Yeah.
I think delusion comes into play. I was very delusional. I actually didn't want to be a professional athlete. When I got diagnosed, I was selecting what universities to go to, and I wanted to study geography because I got full marks in my A levels, and I was like, oh, I'll just study geography because that's what I'm good at. And then I got diagnosed, and this sense of clarity kind of came into my head, and I was like, actually, I'm going to do what I enjoy, and ended up picking chemistry at Queen Mary, University of London. Big up University Queen Mary. I actually wanted to go to Birmingham at first, but I was very wary of the fact that I might need care, so I stayed at home. I'm originally from Leytonstone, East London, so not too far from here. And so, yeah, I just what's the question? Sorry, brain fog.
It was about how you manage two massive things in your life, which is being a professional elite athlete and the headspace that MS takes up, basically.
So when I had my most major relapse so far in my life was when I was 17. So I just couldn't move anything on the right side of my body, and I also was numb on the torso. My sister was training for the World Junior Championship, so she was fully healthy. We were like training side by side. Fun story, actually, we volunteered at the 2012 Olympics, which is a very similar story to you. So I was at the right place at the right time. So we were 16 when the Olympics came to London. We were living in one of the Olympic boroughs, and then we got to volunteer as kit carriers. So I was one of the girls carrying the boxes behind the athletes. And me and my sister saw that and thought, we should give this a go because they're just human beings. And so we were training together off of the back of the Olympics. And then I had my relapse and could barely walk, and then had to learn how to walk, jog, and run again. And then I just kind of did it because it helped me move better. You know, once the inflammation had gone down, that, you know, the whole thing about MS, I did have those residual symptoms. So it was like a lag on the right side. And I found, strangely enough, that running made it better. I got stronger a lot quicker than before I was running. And I just did it because I enjoyed it. And 2 years later, I was professional, and I was like, how did this happen? So I think it has been my savior.
And professionals are an interesting word, isn't it? Because, you know, as a person with MS, you're probably absolutely entirely, as we've heard from a lot of people today, absolutely in tune with every small. I mean, somebody was talking about their eyelid flickering and things like that. I mean, that's tiny, isn't it? But these things are absolutely crucial points to somebody whose lifestyle and profession depends on their body's performance.
Yeah.
I mean, how do you deal with something as terrifying professionally as let's call it a setback? That's happened to you, hasn't it?
Yes, so the picture behind, I was at the World Championships in Oregon in 2022. I actually kept it a secret that I had MS for a lot of my professional career. Mainly part of it was denial. I didn't think I had it, which I think a lot of people can resonate with. And then I was scared to talk about it because there's those conceptions that people think, you know, a lot of people thought I was lying.
Well, were you scared professionally or scared personally?
I thought that it would alter my selection for championships. So when I turned pro, I had just been to the European Junior Championships, got a gold medal in the 4x4, but like I had gone through that selection process, and it's so cutthroat. If you have a dental issue, it can affect your selection. So in my head, I was like, right, if they find out about this, they're never going to select me for anything. So kept that quiet. And then, I got a relapse at the 2022 World Championships in Oregon, which was 3 symptoms in one go. It was left-sided numbness, and the reason I realized I had a relapse was I was putting on my kit, and when I, like, you know, you snap on your shorts, I didn't feel that.
Like guy exercise, come off.
your trousers, and I was like, snap them on.
Taxi for Jameson, please.
And I didn't feel it on the left side, but I felt the snap of the elastic on the right side. So I was like, it can't be. I haven't had a relapse in 5 years. It can't be. My heats were due to start in 2 days, and I just thought, this is the worst time, and no, it can't happen. And then throughout the day, like, I don't know anyone else who's had rapid onset of symptoms, but it was, right now the whole left side is numb and the right side was lagging a little bit. And then I also had balance issues, and I'm a hurdler, so I land on one leg. So I was like, this is not, it's not going to be helpful at all. And yeah, it was the day of my heat, and I was calling my boyfriend, and I was like, he had never experienced me with a relapse. So we were dating for 2 years, and I said, I'm going to pull out, I can't race. And he was like, you have worked so bloody hard, been through so much to get to these World Championships, just go and say that you did it. And that was the reason I went and did it. And then I lined up on the line. I didn't think about the crowd. I didn't think about, them saying my name or anything. I was just like, just get as far as you can in this race.
it's very interesting because you've come on a heck of a journey. I mean, you know, you've mentioned that you've come from a place where one of the first reactions to your MS was it's spiritual or religious and so on and so on. You know, you must have taught yourself a hell of a lot to be in that changing room and in that single moment gone, oh, I know exactly what this is. This is bad news, right? I mean, that's an enormous journey, isn't it?
Yeah, I think at that point I had experienced so many relapses. I won't bore you with them because we've all probably been through them before, but it was, you're so in tune with your body. I had felt that the numbness before. That kind of is the first sign for me that I'm going through a relapse, because it tends to lead on to something else. I don't know if anyone else is the same. But yeah, I just knew something bad was going to happen, and I was trying to like hope that it would hold off for 2 days, but it was a very rapid onset. But I think sport has given me this mental resilience. Athletes a lot of the time line up on the start line and they've got an Achilles, you know, niggle or a hamstring strain or something. They've always got something going on, and I was like, this is just my thing. I've just got balance issues.
And also with regard to sort of teaching yourself and learning on the job as that goes, you must have also figured out, well, this is how I can have a good day, this is how I can have a better day, this is what I need to avoid in order to have a poorer day or a bad day. What are some of the bits and pieces that you would pass on to a ready and willing audience?
I think it's no mystery that, you know, being as healthy as you can help, obviously, help you recover from symptoms. In my head, my body needs to have the resources to heal. I'm very fortunate that with relapsing remitting MS that I've made almost full recoveries from all my relapses. One of my theories as to why I got ill in Oregon, the food is awful. Like awful. When athletes go to like the Olympics and World Championships, we get put in this, like, we were put in university dorms, and we were eating this awful food. You can taste the preservatives. You can, like, it was awful. Everyone was complaining. And I said to the team doctors, I was like, you need to fly me home, like ASAP. Like ASAP. Like being a diva, I was like, you need to fly me home. Because I just knew I needed to be in the best place to recover. I knew I needed my own bed, my dog, my family, my boyfriend, and just my friends, just to be like in the best place possible. So I was really fortunate that they flew me home really soon. I also had the Commonwealth Games and the Europeans in the same year. So I was like trying to recover as best as I could. Spoiler alert, they didn't go well. Came last at the Commonwealth Games. But it was, yeah, I just needed to be put in the right place. And for me, that was just being able to rest. Because obviously rest is a massive thing to recover. And I'm glad that I did that, because the relapse didn't last very long.
So you've literally, I mean, talk about highs and lows. You've been through a lot. Do you live in fear that it's going to happen again? Or do you live in hope that you're going to hold it off and you're going to be strong and healthy, etc.?
Definitely the latter, definitely hope. I lived in fear for a long time. The first few years of my career, I was very much like, this isn't going to last long, just enjoy it. Like, you're going to get ill, you're going to...
Yeah, I've been there.
Yeah, you're going to be paralyzed soon enough, so just, you know, enjoy it while you can. So I was living in fear, and it took me until 2021, the Olympic year. I managed to reach the Olympic qualification, so in my head, I was world class to get that.
In everybody else's head, you were world class too, Lena. But anyway,
it took me to get the Olympic qualification to think that. And then I thought, you know what? It's been, I think at that point, it had been 4 years since my last relapse. So in my head, I was like, I might be doing the right things. You know, the universe is on my side. Just keep going. Because once you get the first bite of the cherry of that success, you just want more and more and more. And so I had to break out that cycle of fear. You know, I always thought, I did that. I think a lot of you can resonate. I wake up in the morning, I'm checking everything. I'm like, right, is everything working? Can I see? Can I move my arm? And then I would just live the rest of the day in fear. And I was just like, I was anxious all the time. I used to bite my nails to the nail bed till it bled. Don't do that anymore. It's great. But I was so anxious. I was so scared of life. And I just thought, I can't live this way. Like, this is my 20s. And you know, they've gone so quickly. I'm 27 now. I'm like, how did I get here? So it's definitely hope, and it took me a long time to get there. But I don't think it's very healthy to live in fear. So,
well, you completely right. True. Well, let me sort of help you out here. Amy's jolly good at French, by the way. You might need some French next year, right?
Might, yeah.
Because there's the Paris Olympics. Tell us about the road ahead for you.
Yeah, so I narrowly missed out on the last Olympics, which was heartbreaking for me. You have to so there's two things you have to do to get to Olympic Games. You have to run the qualification, which I did 3 years ago. So you have to run a specific time. My personal best is actually underneath the Olympic time. So I've run it before, just got to run it again. And then you have to do the trials, which is where I missed out. So there's 3 spots per event per country. So 3 female hurdlers from Great Britain can go. I came 4th. It was heartbreaking. So this next year is definitely me seeking revenge and trying to make the Olympic Games. And I definitely feel empowered. So I only shared my MS diagnosis last year. So when I came back from those World Championships, it just felt like the right thing to do. And my only regret is not.
But did it feel like a risk? Because you were sort of saying earlier on that, I was kind of avoiding this conversation kind of thing. What changed in that direction for you?
Yeah, that's a good question. At that point, I felt like I had established myself in the Great Britain team. I was very honest and transparent so when I stepped off the track, so I actually completed that race, which I was so proud of, because I literally couldn't feel my left side. And I land on the left leg, so I couldn't even feel where I was landing. I literally saw everyone pass me and I was just like, just keep going, just keep going, just keep going. I stepped off the track. My sister was trackside, so I just hugged her and broke down into tears. And I was like, why now? Why now? Why now? And then when I went back to the team, they were like, look, it wasn't a good race. Let's be honest. I was like, yeah. They were like, but we still want you to run the relay. And I said, absolutely not. Like, you think I can hold a baton? Like, no way. So I said to them, look, this is what's going on. Like, I have MS and I've just got a relapse, and a lot of shock.
Yeah.
They were very, very shocked, but they were also very understanding. So I think those fears that I had were very much in my head. And even now, like, I qualified for the World Championships this year, but I didn't get selected. But the team members were so understanding with me. They said, this is nothing to do with the MS, it's just the rules that are in place. And I came home and I sat down on my sofa, and I was just thinking, what now? Like, what do I, like, my whole life, my whole year has been to perform at those World Championships. And my boyfriend works in the press industry. So it's
not that bad.
Yeah, it's not bad. So I said to him, look, I need to get in contact with a journalist because I think it's time. I think I need to, in my head, I was going to explain to the sporting world what went wrong, because I was ranked top 10 in the world, second in the UK. And they expected me to do well, athletics and UKA, so UK athletics expected me to do well, and I came 6th in my heat, so not very good. So in my head, I was going to explain through the media why.
So justifying it, really.
Yeah, to kind of explain, look, I have MS and it just flared up just now. And then when I shared it, it actually came out the day before my heat at the Commonwealth Games. So I was in Birmingham for the Commonwealth Games, and I just get all these notifications on my phone, all my friends, like Instagram, I had to turn off my notifications because the article had been released. And so it was the most surreal reaction. I did not expect it to go so big. People from Brazil so I felt sorry for my boyfriend because he was dealing with all these requests, and it was Brazil, Japan, Turkey, Finland, all these news outlets wanting to get a story. And then when I did end up competing at the Commonwealth Games, and then when I stepped off the track, you go through this media zone, and I had the media officer for Team England just dragging me through the zone, all these microphones thrust in my face. I felt like it was so surreal, and I just didn't expect it to blow up so big. And then they put me in a room, and then it was about 12 journalists, and they were just asking me all these questions. And then the biggest thing for me was social media. So many people, especially young females, were reaching out to me, and I made a thing to sit down and reply to every single person, because
that's amazing.
Every experience, I thought I was completely alone. And obviously we all did. So I thought I was completely alone in my experiences, but to hear from all these amazing young females.
Well, let me
it's crazy.
Ask you this then, just to wrap up.
Yeah.
Give us a takeaway for all of those people in this room, online this afternoon, and so on and so on. And anybody that maybe in the next few months or years joins MS Together, just crystallize it. What do you want to say to them?
Don't write yourself off. Because obviously one of the things we get is, right, your life is going to change, it's going to stop. And yes, my life did change drastically, but I just continued through sport just because I enjoyed it and stuff, and you just never really know where life is going to take you. And a lot of the people that reached out to me, one of them was an Olympic skier, another one was Olympic gymnast. These people are like completely quiet. One of them was a presenter on
Okay. Oh wow.
popular
good stuff.
TV.
Wow.
So I was really shocked. There's a lot of people out there, a lot of people who are still quiet because
Yeah.
it takes time for you to be able to be confident enough to share
Amazing.
what you're going through. So there's a lot of people out there who are exactly like us and who are still continuing, as much of many of us are in this room, still continuing as much as they can with what they have. And you just never really know where the journey can take you. I never expected to be in a room full
Yeah.
of like-minded people.
Thank you very, very much.
Thank you so much. No, it's
Nina
incredible.
Nielsen, everybody.
What a wonderful interview. Thank you, Lena. Thank you, Tom. Unfortunately, okay, everyone wants to give me a mic now. We've come to the end of our agenda today. So I'm going to hand you back to the wonderful Amy to close us out. Thank you for being such a marvellous audience and for engaging everything we've asked you to do. I will bow out now, and Amy, I'll leave it in your capable hands.
Yay. Okay. So I hope you all enjoyed today listening to more about how MS affects young people and how MS Together can help. It's gone so well that I'm really chuffed. So now I just want to say a few thank yous and let you know how you can get in touch with myself or the team. So I've got quite a few, so bear with me. So a massive thank you to all our speakers today, Tom, Ruth, Rosanna, Brian, Cressy, Mia and Lena. You were all amazing. I've missed Niraj. I said Ruth, I missed you. I'm sorry. Yeah, you were all absolutely amazing and I couldn't have asked for better speakers. Tom and Marissa, thank you for the parts you've played. I've already said thank you to Tom, but thank you again, Tom. I clearly haven't written this speech very well. But yeah, thank you to Marissa for running around with the mic. Thank you to Vanessa for hosting. You were brilliant as always. A massive thank you to our volunteers. So it was briefly mentioned earlier, but not many of you will know, but MS Together is currently entirely run by myself and a handful of volunteers. And at the moment, every single volunteer is a young person living with MS. So yeah, I just can't thank them enough. They literally make everything possible and I couldn't do it without them. And a special thank you to all the volunteers today in the pink tops. A little round of applause for them. And I just also want to say thank you to our board of trustees. So that's Niraj, Tom, Vanessa, Annabelle and Elaine. Thank you for believing in me and MS Together. Healthcare professionals in attendance, thank you all so much for coming. It means so much to be able to get you in the room and just to be able to tell you about MS Together. So yeah, and if anyone wants to work with us, please get in touch. Fundraisers, to everyone that's fundraised for us this year, to those who have taken part in their own initiatives, just to name a few, we've had Fiona Hughes, Amy Hambleton, Reese Kelly, Robin Hatcher and Roseanne's Runners. They all did incredible fundraising for us this year and last year. To anyone who's shopped using Easy Fundraising, and to those of you who have done a birthday Facebook fundraiser, Liana, and just anyone who took part in our Move Together for MS fundraiser. Obviously, every penny counts, so fundraisers are, yeah, just amazing. Stuart isn't here, is he? But he is in my speech. So Stuart has done some brilliant work for our website and setting up our email. So I just wanted to say a little thank you to him, so you can pass that on, Vanessa. Our amazing singer, there you are. Our amazing singer Courtney, who is actually a part of MS Together, and our photographer Rebecca. Can't wait to see the photos. To every single member of MS Together, you make it the safe and supportive place that it is, and you've helped it grow. And yeah, just very grateful for you all. My family and friends, thank you for your support. A special shout out to my mum and lovely boyfriend for your ongoing support, for helping me prepare for this event, mum for doing all the name badges, and to both of you for listening to my ideas and rants about MS Together for the last few years. HSBC and Sam, of course, for hosting this event, and to all the staff who have helped today in the lead up. Yeah, thank you for making this possible. And finally, thank you all for coming. I know lots of you have travelled far or had to book time off work, so I really do appreciate every single one of you being here. And thank you to everyone who is on the live stream, who has made it to the end, or just anyone who could pop in. I know it's not as exciting as being here in person, but it's so nice to see so many of you that have tuned in. And we haven't ignored the questions that you've sent in. We will try and get you answers to those at a later date. I've forgotten my clicker. Okay, just a little bit about how you can support us. So as a brand new charity with little funding, any support you can give is so appreciated. And as you can see, there are lots of ways you can support us. Of course, we always welcome any donations, big or small, and there is an optional donation today. We've got some donation pots outside. We can support with any fundraising activities that you'll be doing, and we'll also be organising another national fundraiser in 2024, so do keep an eye out for that. As mentioned, we are a charity managed entirely by volunteers, so we're always looking for people to join our team. Collaborations, I've mentioned this before as well, but working with healthcare professionals, organisations, or anyone who could benefit our community, we're always looking to work with you. And then, yeah, there's lots of other ways. There's so many ways that you can support us, so do get in touch. So yeah, if there is, any way that you think we could work together, if you want to support us, or if you have any questions, you can get in touch through any of the following ways. And we're going to finish with a little video of support from some very wonderful people who couldn't be here today, but wanted to wish us luck. It should play. Ooh. Hang on.
12 months ago, Amy helped me to launch my own campaign called MS Must Stop. So now I'm delighted to help her to launch MS Together. MS can be a pretty rough disease sometimes, but I'm really pleased to see that MS Together is going to help young people particularly to live the very best life they can, whatever their MS is going to throw at them. So good luck, Amy, and good luck, MS Together.
I found MS Together when I was looking at Facebook groups, and I loved the way that it was aimed at people the same age as me. In joining, I have met some of the most incredible, inspirational people ever that have made me realise that I'm not in it alone. And to be honest, I don't know if my diagnosis or life would be as easy as it is without them. So I'm forever thankful for what they've given to us as a community of young people suffering with multiple sclerosis.
I would like to wish Amy and the team at MS Together the very best of luck. The MS world is a minefield of advice, conflicting information and fake news, putting so much additional stress on individuals' mental health when they are already having to deal with diagnosis, physical symptoms, and the unknown. That is why the work of MS Together is essential at providing that very much needed support for young people.
Being a part of the MS Together charity has helped me feel less alone in this MS journey, and I wish them all the luck in the world for this charity launch.
I really am thrilled that MS Together is finally getting its official launch. The work that you're doing to support young people being diagnosed with multiple sclerosis is just so fantastic, so needed, and so important. So good luck with today. Good luck with all your work in the future. I'm really looking forward to following everything that's going to be happening, all the good things that you're going to be doing. And I'm really, really happy to be supporting you.
MS Together really helped me when I was newly diagnosed, which was during the pandemic, as it made me feel connected to people who are in a really similar position to me.
I, like so many others, have made such meaningful connections through MS Together, and it is a charity that I am super proud to support. I hope everyone is having an amazing time tonight at the launch party, and I look forward to seeing what the future holds for MS Together.
As somebody who lives with somebody who suffers with MS, I can understand and appreciate the value of having a support system.
And on that note as well, I do want to thank MS Together personally, because as somebody who was diagnosed at 25 years old with very little support system around me, I know how difficult it is and understand communities like this are just incredibly important. Probably the most important part about the diagnosis is having a support system. So I'm grateful for your charity, and I hope your event goes beautifully tonight. I hope everybody's having a great time, and thank you again for everything that you're doing.
Okay, that's the end. Thank you all. Thank you all so much. The bar is now open, and and yeah, I just really hope that you've all enjoyed it as much as I have, and thank you again all for being here. Thank you.